For those of you who aren't familiar with us, we are 90 Degree Benefits. We're one of the top 10 largest independent TPAs in the country. We actually have 22 offices nationwide, serving over 500,000 members. So a large organization, but still kind of have that small time feel where you know exactly who you're reaching out to. You have your dedicated staff members, all that good stuff. But we've got the numbers behind us to prove our success. But my name's Tyler Fletcher. I'm the president of the Georgia location for 90 Degree Benefits. You're going to hear from Tom Davenport. He's the vice president of business development for the Georgia office. And then we're lucky to have Steve Schultz with us. He manages the One Plan dental program and is a dental expert. I'll let him give a more detailed bio when he's up. But very lucky to have him to be discussing the dental portion of this. But just to give you some quick background on where we are as a particular location in the Georgia office under the 90 Degrees umbrella, we really try to specialize in unique approaches to healthcare and the industry. 90 Degree Benefits is all about innovation and moving the ball forward and coming up with new ideas. We administer a large block of fully insured gap business in the Georgia location. And one day we got to thinking, why don't we include this with the major medical plan? And we came up with a one-card system, and it worked great for the gap business we have, for the major medical business we have. Again, we always want to come up with solutions when we're thinking through things. We think, what would make the client's life easier and what would make this product easier for our broker partners to sell. And that's how we came up with that one card system for the gap. Well, one day we were sitting around and we worked with Steve and known forever. And we said, why don't we do this with dental? It works so well with gap. Let's roll out dental. So we found one of the top stop loss partners in the industry who got completely behind the concept. We rolled it out. To our knowledge, it's one of the only plans like this in the country. There could be one or two out there that I'm not aware of, but this product actually has the dental embedded in the major medical. No annual limits. Your dental claims track towards the out-of-pocket max. And most importantly, you get back to that one-card system, which is really neat thing. And it also encourages members to use their dental benefits. A lot of people, when they hear this concept, they say, well, dental's kind of on the side, or why don't you just throw it under the aggregate? We want to encourage people to use their dental benefits because it affects their overall health and well-being. So that's just a brief background on who we are. I'm going to hand it off to Tom Davenport. But again, thank you so much for joining us today. You'll get all the contact information after this webinar, and feel free, to reach out anytime. Thanks.
All right. Good afternoon, everyone. I wanted to mention a couple of brief notes about the medical component. As Tyler said, we partnered with one of our best carriers, and the medical engine behind this, the One Plan solution, is a self-funded option. And we do have traditional self-funding options, and we have level funded options as well. We really wanted to try to target a large audience because we think this product's going to really resonate well in the marketplace. With the level funded offering, we can go all the way down to 15 enrolled and all the way up to 150 enrolled. Again, we have traditional self-funded options above 150. But for the level funded option, again, that's a large audience. We really wanted to hone in with some product flexibility and come with an underwriting tool that makes it easy, again, for us to offer this out to a large audience. So the Sarah underwriting tool is a proprietary tool to this program, where it allows us essentially to underwrite the group with a group questionnaire only. So we do not have any individual health questionnaires that we have to obtain on the front end or on the back end. We go through a couple of internal forms, and then we get the one-page group questionnaire filled out. And then the underwriters use some of the AI tools that everybody's familiar with to then score the group and provide firm rates from there. So again, we thought that would be important to be able to roll this out to a large audience. One other thing I wanted to mention is we do have the Cigna National Network with this group. So again, traditional self-funded options, level funded options, group questionnaire underwriting only, Cigna National Network. And then there's a lot of other important benefits to the medical plan, but don't want to deter too much from why we're here today with the One Plan. So we're going to send up a follow-up email to all the attendees with more information, flyers, contact information, the recording link that Tyler talked about. And so please reach out afterwards for questions, follow-up discussions, anything we can do to help. And we will, schedule those meetings. But for now, I wanted to go ahead and turn it over to Steve Schultz and really talk about the one plan, the conception, and why we think it's going to be very successful in the marketplace.
Thank you, Tom. Thanks, Tyler. Good morning, good afternoon, wherever you are in the country. We've been involved in the dental side of group benefits for over 30 years, and we're bridging that together with this combined plan. So I want to thank everybody for participating. We think this is a big step in benefits, one of the significant ones that will create momentum as this moves down the time path, excuse me. So let's look at the agenda, what we're going to talk about for the remainder of the presentation. We're going to do a brief comparison of medical plans, which have, as you know, unlimited, essentially everybody gets 100% coverage at some point. And we're going to compare that with the limited benefit dental plans that exist today. Also, we're going to review examples. This is to illustrate how healthcare, dental care is healthcare. So we're going to show how better oral health reduces medical plan costs. And we're going to introduce the two new products that we've started today. One is called One Plan, which is, Tom, if you want to keep going down, please. One Plan, it's combined group medical and dental. It's the acronym is GMED, Group Medical with Embedded Dental. So in the medical plan, there are specialties, healthcare specialties. The only one that's excluded is dental. So this is a medical plan that excludes dental and treats it like it should be as part of healthcare. For employers, once you've done your job and educated employers that there are holes in their healthcare plans on the dental side, if they decide not to go with one plan because they love their current dental plan, then we have it's a dental plan. It's actually a fully insured dental plan that provides similar benefits as the one plan. Okay, next slide. So what is the opportunity with this? Again, we've had 30 years doing dental plans, unique dental plans that we have clients nationwide that use the plan. It's a little different, but about 15 to 20% of them came directly to us and said, we want a better dental plan, a better oral health plan for their employees, better than what the other insurers were offering. Why were they asking for that? Because they recognize that traditional group dental is weak financial protection. It's really apples to oranges comparing a group medical to group dental. And they want to attract and retain employees. And this gives them a better benefit, a better way to attract and retain those employees. And frankly, they do not care if it costs more. They're spending far more dollars in non-traditional benefits. So to offer a better dental plan, obviously the money comes from somewhere. So they don't care if it costs more. And we've been doing this for 20 years. We have, 30 years with employers all across the country that have actually asked for higher benefits. So who's going to be receptive? Any employer that has non-traditional benefits. Those are the obvious ones. They have an on-site cafeteria. They allow remote work. They have pet friendly. They have on-site services like a gym or daycare. They're looking for benefits, better benefits beyond the traditional life, health, disability, retirement plan. Industries that historically like better plans are healthcare. They're smart about health. They want better health plan. Education, the greatest user of dental care in the country are teachers, the faculty and staff. They're well educated and they have the schedules that allow them to get treatment through their local dental office. Manufacturing, tech, legal, finance, banking. These are highly competitive industries that are looking for better benefits. And so this is the opportunity that we're presenting. Just a little background, the dental history. The first dental plan was created in 1954, and it actually discourages treatment. Whenever you have a 50% coinsurance and an annual limit, you're discouraging treatment. Patients are going to choose lower cost alternatives, or they're not going to get the care at all, or they're going to defer it until next year. So there's no significant financial protection with the first group dental plan and the one today. Today, in 2024, it's roughly the same group dental plan. It's often sold by benefit brokers with the lowest cost on the spreadsheet wins. They're all about the same, so why not go with the lowest cost plan? And that works for some employers, but not all. Stepping back, what is the purpose of insurance? And we forget this sometimes. It's unexpected events that cause financial hardship. It's not supposed to be for minor expenses. It's supposed to be something that hits your wallet and something you can't react to. You don't have the cash. So the current dental plans, however, they don't provide financial protection. They might pay for your cleanings and exams, but when you need major care, it's 50% coinsurance with low annual limits. That's not insurance. This is proving that, and this is from the American Dental Association, the frequency of tooth extractions equals the number of tooth repairs. So when the employee or the patient has the ability to get it repaired, they're choosing extractions. Why? Most plans for an extraction pay 80%, which means the patient's going to pay less than $100. If they only have $400 or $500 in their wallet and it's vacation time or Christmas time, holiday time, they might choose an extraction. For crowns or implants, though, 50% coverage is what the patient pays. So they're out of pocket an enormous amount. And what if they need 2 crowns that year? It happens. So who benefits from this? The insurer benefits because they're forcing patients to choose a lower cost extraction, which means less money out of the plan, more into insurer profits. And the patient has to pay a bigger part of the bill if they are getting the repair done. So what do we have? Today we have 2 diametrically opposed plans. We have this group medical plan. There's 136 medical specialties in group medical plans. Only one at the bottom down there, dental, is not covered. So in 1954, a different plan was created to cover dentistry. The group medical plan provides full financial protections, unlimited 100% coverage. Group dental, no financial protection, because once it gets big, there's no coverage. Just looking at the plan. In group medical, as medical costs goes up, as they increase, the coinsurance goes up. So that's the financial protection. On the dental side, as dental costs go up, the coinsurance goes down. That's backwards. And it also keeps going down to 0 because there's an annual limit. So once you reach the annual limit, 0% coinsurance, no insurance. You're uninsured. So traditional group dental is like being uninsured. When you reach the annual limit, you have no insurance. And these are the procedures that patients are not getting done. Moving on to the cost. This is just the cost of the dental procedure. This doesn't include the preventive exams and maybe a filling or 2 you might need in a year. This is just the cost, the average national cost for a crown, bridge, root canal with a crown, impacted wisdom teeth, an implant, and major dental oral restoration. And that happens. I have a niece who needed that, and it was paid out of pocket. This is if you go in network. Unfortunately, a lot of employers make the dental plan optional. So what are the patients going to pay the participants if they don't choose the plan? This is what the average is if they don't have the plan. They're paying far more for the same procedure. These are called the street prices or the market price. They opt out, they lose the discounts. So the discounts provide almost as much benefit as the plan itself. Okay, so let's talk for a minute about why dental care really is healthcare. This is a clear statistic. There are 2.1 million ER visits every year for dental pain. And who pays that claim? It goes under the group medical plan. It's because employees did not elect the dental plan, or they have bad benefits, weak benefits. And there's $2 billion spent on that just for ER visits. Diabetes, the national bill for that is $413 billion. There's been a couple of studies that bill can be reduced by 12 to 14% if the diabetics are treated for gum disease. So a lot of the diabetes is complicated or started by gum disease, but they have weak benefits. So if you fill that hole, you're going to reduce that 413 billion by about 12 to 14%. Arthritis. Part of the reason arthritis, one of the causes is bacteria. Bacteria that spreads from the mouth to the joints, causing inflammation. There's 140 billion spent on that. So when you don't have a good dental plan or with good benefits, you're encouraging these big bills. Premature births, 26 billion spent on that. Again, studies have shown that the oral bacteria spreads to the uterus, increasing the likelihood of a premature birth, which is horrific, and it's expensive. And if you can control that with better dental care, it makes sense. And these are more recent studies, dementia and Alzheimer's, 305 billion. And one of the factors is oral infections that start in the mouth. An infection expands to the brain. It starts in your 40s or 50s and starts slowly creating these conditions. And again, that's a significant bill. Just some dramatic proof that dental care is healthcare. This was last December. This is a 36-year-old NFL player, retired NFL player, Mike Williams for the Tampa Bay Buccaneers. He had a dental infection. It spread from his mouth. He did not see the dentist, did not see a doctor, just ignored it for too long. That infection spread to his lungs and his brain. It was overwhelming so that antibiotics did not work, and he died. So better dental care. We don't know why he didn't go to the dentist, but he was not aware that it might get worse. It might spread. We separate the mouth from the rest of the body as if it's not part of the body. And that's what one plan is trying to do, is saying it's one of the medical specialties. This is about a month ago. Bacteria found in 50% of colon cancers starts in the mouth. So they're already working on a swab that the dental office will be able to use to swab and see if you've got a preponderance of this bacteria. And if so, they can send you to your medical doctor for treatment so that it doesn't end up in colon cancer. So again, this is an example of a tie-in between medical and dental. For the last 30 years, 50 years, we've separated it. It needs to be joined together in the health plan. So the solution is the two new plans with better dental benefits. One of these is what we're calling one plan. You combine medical and dental. There are two plans into one plan. So now you have one plan. Again, the GMED, group medical with embedded dental. It's the first one that we know of that combines these and treats dental care like healthcare. This plan is available for employers with 15 or more employees. And again, as Tyler had said, there's no individual health applications. The dental side of it, inside of the plan, it's not a separate benefit. It's embedded in the plan. You get free preventive visits. Then if you have any other treatment, like you need a filling or a crown or a root canal or an implant, 80% is paid for that plan. The employer can choose a deductible for that from $50 to a higher amount. And then it pays 100% at the out-of-pocket. So at the medical and dental out-of-pocket limit, it pays 100%, and there's no annual limit. So dental finally becomes medical. The advantage is dental is treated part of healthcare since we've demonstrated it is. It's part of it's one plan. There's one election, makes it easier, one ID card. There's one customer service number and one anniversary, makes the broker's life easier. All expenses contribute to the out-of-pocket limit. And there's 100% refund of any unused claim funds in the plan. Copays and deductible. This is an extra feature. Any copays, deductibles, or co-insurance can be paid over 12 months with no interest. Each employee gets, or each family gets a card, Visa healthcare card they can use at any pharmacy, any doctor, any hospital, any dental office. And if they have an out-of-pocket, it's spread out over 12 months with no interest, no penalties, no employer liability. So if the employee leaves or doesn't pay, the employer doesn't pay a penny. The funding is traditional self-funded or level funded, and you see the networks on the screen for medical side of it and the dental side. So that's the one plan. Again, for those employers who say, you've convinced me, I know I need to do something better on dental, but I don't want to leave my medical plan for whatever reason, then through 90 Degrees, you can also have a Max Super Dental, which is a standalone dental plan. It's fully insured, 10 plus employees. It is available on a self-funded basis for 50 or more employees. This fully insured will be available Q4, fourth quarter of this year. And the networks for the dental are Aetna, Sun Life, Dynamax. We also have a network-free version, and you'll be surprised at the number of employers who say we don't want to do that. We want to let employees go to any dentist. We will pay more for it because it's small in the big picture. The benefits in this, again, are very similar to what's in one plan: free preventive visits, and then 80% of any other care after the deductible chosen by the employer. And then with that credit card also available with no interest, and annual limits in this. Since it's a standalone plan, it's $30,000 annual limit. And this is a summary page just refreshing what we've talked about. And those are the two plans. Again, the one plan is available now for 15 plus employees. The self-funded Super Max Dental is available now, and the fully insured is later this year. So that's where we are, where we've got a few more minutes if we have any questions.
Steve, we do have a couple of questions. Debbie Ryder asked if we could show the network options again. It looks like those are on the screen at the bottom, Debbie. Aetna, Cigna, First Health, PHCS Multiplan for the medical, and Aetna, Dynamax, and Sun Life for the dental. And of course, we have the non-network option for the dental that Steve talked about. Lee Venna is asking, how is the Visa card funded, Steve?
The Visa card, each employee receives essentially a $1,500 per year credit limit. It's not funded by any funds. It's simply available for them to use. So there's no funding required. So the employee gets an app, and if they charge, let's just say they need a prescription drug for $65 that they didn't expect, or a $300 x-ray that their doctor required, or suggested, they can go ahead and get it, and it's going to be paid out of pocket. They decide, I want to pay this over 2 months, 4 months, 6 months, 8 months, 12 months, whatever they want on the app. And it's done either through a payroll deduction or through a checking account or savings account that the employee has automatic every month. There's no interest, and there's no penalties for to the employer if the employee leaves and hasn't paid the bill back. That's between the Visa card holder and the participant.
Okay, great. And Debbie Ryder also asked, are number of preventative visits limited?
Under the one plan, yes, they are 2 per year under one plan. Under the self-funded dental, no. But it depends on the size of the employer. That usually will be modifiable to add another visit, because some dentists are saying that certain patients in their 50s and 60s more often need 3 visits a year. So if that's important to the client, we can take a look at that
Okay,
under one plan.
Perfect. And John asked, no Cigna network for self-funded. No, we do have the Cigna network for self-funded, John. So whether it's the traditional self-funded option or the level funded, we do have that Cigna PPO national network available. Somebody asked, what are the participation requirements for both plans? So for the medical, I can speak on that real quick. There is a 75% participation requirement for groups over 150. That drops to 60% once we get over 150 enrolled. But for that audience under 150 with the 75%, we do consider valid waivers. That works to help for those participation requirements. So we will consider valid waivers. Kim Langley, we will be sending the recording. We'll send a follow-up email to every attendee on the webinar today. It'll have the recording, it'll have some flyers, contact information, all that good stuff. So you can review that and reach out with any questions. So next question, how is the underwriting handled on the health piece with the networks via 90 degrees? So we have two product offerings. We have a level funded product and a traditional self-funded offering. The traditional self-funded is going to be typical, underwritten off experience. But for the level funded product, from 15 enrolled to 150, we do have a very unique AI underwriting tool that allows us to get firm rates off just a group questionnaire. So we do not have to do individual questionnaires, don't have to do those after the fact. We have one group questionnaire and a couple of internal documents. And again, we'll send this out after the meeting. But once the employer or a representative at the employer group fills that group questionnaire out, it's underwritten by our carrier. They run some AI tools, and then we're able to provide firm rates from there. So very, very popular in the marketplace with that SARA tool is what we call it. SARA is the acronym. Jasmine asked, coverage verification is difficult. Automated system is not helpful, having difficult time to file claims. Steve, does that resonate with you on the dental side?
No. No.
Jasmine, we'll take that as a follow-up, Jasmine, and see if we can respond to that specifically. Lorenda asked, will you send the slides to our email with the recording? Yes, Lorenda, we'll send out a copy of the recording link so you can review this. And then how to quote, actually on this last slide here, we have contact information for myself and Tyler Fletcher. And we also have an RFP mailbox here that is oneplan@90degreebenefits.com. And again, Lorenda, we'll send that out in a follow-up email so you have that contact information. This is great. We're getting a lot of questions here. Lee is following up on the Visa card funding. He's saying, if there is no funding, is this like a care credit, but through the Visa network? And can this link to an HSA or FSA?
Yes, it can link to an HSA or FSA. There is, what was the first part of the question?
The first part is this like a care credit, but through a Visa network? Are they pre-funding a card, or is this
No,
like
there's
your
no
opening line of
pre-funding. There's no interest gotcha, after 10, 12 months where, hey, you didn't pay, now you're gonna have to pay 30%. None of that. It's simply a plan built into the card, built into the plan that where the card provider is funding this through a it's a $3 charge added to the employee rate, which can be removed. So if an employer doesn't want to do this, they don't have to. But that's included in the rate, and that funds it. That funds the use of it, along with the merchant fees that your dental office or doctor's office, the 2.9% that they pay to utilize cards. So that's how the finances work behind it.
Yeah, it sounds like it is pretty similar to Care Credit Lee, and we'll get some specific information on that and send that over to you. Is the dental participation requirement the same as the medical requirements? Steve, do we have any minimum enrolled?
Yeah, on the dental, on the self-funded, it's a 50% participation. Obviously, the more participation you get, there's a factor that reduces the premium equivalent. On the self-funded, it's 60 to 70%, depending on on the fully insured, which is later. It'll be 60 to 70%, depending on the size of the employer.
Okay. And Jasmine's asking she has a patient that has this coverage as a secondary, wants someone to reach out. We definitely will, Jasmine. Thank you. And is there a cap on a max renewal increase for groups 15 to 100? I don't believe, Tyler, are you aware if there's a cap with this carrier?
No, not on the major medical side.
Okay. All right. Good questions. Let's see. There's a chat and a Q&A. Michaela asked, are these products available in all states? Almost all states, Michaela, with the exception of New York, I think Alaska, Hawaii, Alabama. I'll make a note to include the product availability state list in the follow-up email.
Yeah, and on the dental side, the self-funded is available in any state. The dental standalone side, on the fully insured, is available in every state except New York, unfortunately.
Okay. And Tom Davidson's asking, is there a vision component to this, and do we need a member level census? I can confirm that we do need a member level census to do the AI underwriting. Steve, is there a vision level component to this?
Yeah, there is. It was too much to include in this meeting, but
Sure.
that is available.
Okay, great. And then I think this is the last one. Nicole is asking, how much is this increasing the rates? That's a good question. So what is the factor for adding dental into the medical?
In some ways, it's very small because it depends on the group. So there's no direct answer. It's not a huge increase. You're not going to see 20, 30, 40% premium increases to get this, because the frequency of utilization above the $2,000, $3,000, $4,000 limit is low, but it does cause problems for those employees or patients who do need it. So you could expect on the dental side itself, in some cases, a 5 to 15% increase on the rates.
Okay, great. And one more, let's see. We got questions coming in the Q&A and the chat. Thanks, everyone. This is great. I think this is a fabulous product, and I hope it goes completely viral. Thank you so much. For instance, if the group is domiciled in Texas but has an EMPS located in Alabama and New York, are the employers covered in those two other states? Yes, as long as the domiciled state of the corporation is in a state that allows the product, then we absolutely are good to cover employees that reside in those other states that don't cover the entities. So yes, in your example, if the group's domiciled in Texas, but we have members living in New York, we have no problem covering those members, and we can cover that group because the headquarters is in Texas. Here's a comment about people and dental infections. Is the medical and dental reporting combined? That's a great question, Sarah. We're actually working on that to see if we can combine that. It looks like it's going to be. And so we're working on bringing those together for your loss ratio reports and all the other reports that come with that. If a group is healthy at inception, but then has some high claims, will they get a very high renewal? What is your renewal methodology for the medical? So on the medical side, this is a self-funded solution. So every group is underwritten on their own claims experience. So high claims can absolutely impact the renewal. But I will say this, our carrier partner is very creative, very willing to work with us on renewal. And because it's a self-funded plan and we have the transparency, we're able to kind of dig into those details and see if there are some things we can do for those high claimants that can then help bring that renewal down. Can you say, Steve, do we have info on the vision that we can send out in the follow-up email?
Hey, we do.
Question from Ida Grady. Hi, Ida. If employee terms and has a balance, you mentioned that it is between Visa and employee. How is that handled? Is it by Visa or by the major medical carriers? And what bank is the Visa card through?
I do not have the bank information with me here right in front of me, so we can get that to you. It's handled by Visa, the card provider, which is it's not the plan, but that if there's anything due by the employee or participant in their family at termination, or if they're no longer involved, or for whatever reason cannot pay, that's not it. The employer is completely removed.
Okay. And Steve, on the question, back to the question of how much this increases the medical offering, that 10%, 10 to 15% increase, is that adding in is that combining the dental and the medical cost?
No, that's just in the bump in the dental. So there's going to be a dental component of the medical, which if you don't have dental in your medical plan, there's no dental component. So when you add the dental component, the normal dental component, and just for example, a national average on normal dental is $34 to $42, depending on where you are in the country. That's going to go up by about 10%. To cover the excess claims.
And then Tyler, I think on the medical side of that, it's very minimal, if anything at all, correct?
Correct. And since it's all individually underwritten on a case-by-case basis, obviously they'll take into account the overall risk of the group.
Nicole, we'll send some examples of pricing so you can kind of get an idea, and we'll break it out. Here's the medical pricing, here's the dental, so we can get our heads wrapped around that. Russell Head, hey, hi Russell. Is the Aetna network available for less than 100 employees? Tyler, do we have the Aetna network currently for under 100?
It's not quite ready to roll out yet, but we'll get you some information on the Aetna network once that's available. But it's coming very soon.
Okay. Nicole says thank you. And let's see. Can you laser a member that has had high claims? Absolutely. We do have the ability to put in lasers. Again, our carrier partner, very, very creative with putting in solutions. I think somebody asked who the partner is. It's Strategic Underwriting Solutions. And then there's a couple of different carrier papers that comes with. And what needs to be included with an RFP submission. For level funded, we'll send out, there's a couple of forms to complete, and then the group questionnaire, and then a member level census, and that's all we need. For traditional self-funding, a little bit more information, typically what you're used to with claims experience, current renewal, current benefits, all that good stuff. But for level funded, we have a member level census, an internal form with group information, and that one-page group questionnaire. Those three items are enough for us to be able to get a quote and to firm and finalize it. On the pricing, is it carved out? Are we bundling the dental and medical price into one, and when we're illustrating it in a proposal? Okay, that was just asked. So yes, so the pricing will be bundled into one. Thanks for the question, Blake. And let's see here. Russell, will you be sending out the medical plan design options in your correspondence? Is there any rate relief with competitive information, or is the final rate finalized with no negotiation? We can absolutely send that, Russell. We do have a lot of plan design options, so we can get very close to matching current, but I'll send that to you directly because I think we have about 35 plan designs. I'll send that to you, and then absolutely, this underwriter is willing to look at any and all competitive information to see if it can help us, with the rate and sharpening the pencil a little bit. All right. Those are great questions. Thanks, everyone. They're coming in via chat and the Q&A, so I was bouncing back and forth, but thank you. Those were absolutely good questions.
Yep. And to Tom's point, we'll be sending out a follow-up email with all this information, and feel free, please reach out. We'd love to talk through any cases you have, and we're accepting RFPs. So send them our way, and we'll see what we can do. Okay,
right.
Tom, Steve, anything else?
No, that's it. Appreciate everybody's time today.
Yeah, thanks so much, everyone. Appreciate your time, and we'll be sending that follow-up email soon. Everyone have a great rest of your day.